Some of the most common medications you take every day are silently damaging your bones. No pain, no warning. One day everything feels fine, the next a simple fall causes a fracture. What is the scariest part? Some of this damage can be permanent. In this video I'll explain which medicines weaken bones and what you can do to protect your bones. Now let's talk about which medications can harm your bones over time. The first on the list is steroids. Medications like prednisone, dexamethasone, or hydrocortisone, often prescribed for inflammation, asthma, or autoimmune conditions. Long-term use of corticosteroids can reduce bone density, making bones more fragile and increasing the risk of fractures. This happens by slowing new bone formation and speeding up bone breakdown over time. Next we have proton pump inhibitors. Medications like omeprazole, pantoprazole, or esomeprazole, commonly used for acid reflux or heartburn. They might seem harmless, but prolonged use of PPIs can interfere with calcium absorption, a crucial nutrient for bone health. Another surprising medication is antidepressants, specifically SSRIs, selective serotonin reuptake inhibitors, like fluoxetine, sertraline, and escitalopram. Research shows that these medications can interfere with bone metabolism, increasing the risk of fractures in older adults. While antidepressants are essential for mental health, long-term use may silently weaken bones, increasing fractures risk over time. Let's not forget that anti-seizure medications, like phenytoin, can lower vitamin D levels, an essential nutrient for bone health. Without enough vitamin D, bones become weaker, and the risk of fractures increases. So, how exactly do these medications affect our bones? Most of these drugs interfere with bone metabolism. For instance, steroids can reduce calcium levels within the bones, gradually weakening their structure, while acid reflux medications lower stomach acid, which is essential for proper calcium absorption from food. Antidepressants impact balance of bone-forming cells and bone-resorbing cells, making bones more fragile. Now question is, what are risk factors and who is most affected? Not everyone is equally at risk. Some people are more vulnerable to bone damage from medications. If you're older, taking high doses of bone-damaging medications, or using these medications for long periods, your chances of developing bone issues are higher. Risk factors include having a low-calcium diet, lack of physical activity, or having a bone disease like osteoporosis also increase your chances of developing bone issues while taking bone-damaging medications. Now let's talk about how to protect your bones if you're taking bone-damaging medications. The good news is that there are things you can do to protect your bones. First, talk to your doctor if you're on long-term medication that could harm your bones. They may recommend a bone density test to check how strong your bones are. Next, ensure you're getting enough calcium and vitamin D in your diet. You can get calcium from calcium-rich foods, which include dairy, leafy greens, and fortified foods, and vitamin D can come from exposure to sunlight and taking vitamin D supplements. Exercise is another key factor. Weight-bearing exercises like walking, running, or even weightlifting can help strengthen bones and prevent fractures. Now you know which medications might be secretly harming your bones and how to protect yourself. Make sure to share this video with anyone who may be at risk. If you found this video helpful, don't forget to like, subscribe, and hit the bell for more health tips and updates.